Hi, Ms. Gregory.
Hi.
Hi, my name's Markus.
Nice to meet you.
Nice to meet you too.
How are you doing today?
Good.
Good. So, I hear that you're interested in our position at Centera Hospital?
I am.
Good. Okay. So, can you just tell me a little bit about yourself?
Well, I'm from Jackson, New Jersey. I moved down here to Virginia 4 years ago when I was first a freshman at Shenandoah University. I was an EMT beforehand, so I've always had an interest in healthcare, and I want to start my career off with a good hospital. So I thought you guys would be a good match.
Good. Okay. So can you tell me what interested you in becoming a nurse?
Well, like I said, I was an EMT in high school. I got a lot of work and experience in the healthcare field, and not only you work with doctors, you work with firefighters, you work with all aspects of healthcare, but especially the nurses. The nurses are the core group that you work with on a daily basis.
Good. Okay, so can you tell me what are some of your strengths?
I would have to say that some of my strengths are that I'm a hard worker. I'll go above and beyond to get something done. I enjoy working with people. I'm a very friendly person. I probably talk way too much. So yeah.
Good. Okay, so going off of that, now what is your greatest weakness?
I think sometimes, like I said, I work really hard. I think one of my weaknesses is knowing when to stop and knowing when enough is enough and to ask for help. So I think that's definitely a weakness, but I'm working on it.
Yeah. And how do you work on that?
Well, I work on that by trying to be more cognitively aware of when I am getting to my breaking point and asking for help. I think my professors and my fellow classmates have been really helpful in encouraging me and to get through hard tests and hard clinicals and stuff like that. So I think I've gained a better understanding of how to work with people and how to ask for help when needed.
Good. Okay, so what is your clinical area of interest?
Well, my clinical area of interest would have to be intensive care. For the past year, I've been working at Monmouth Medical Center up where I'm from in an intensive care unit as a tech, and we draw blood, and we do vitals, and we do blood sugars, and we're able to help nurses wherever they need help, and I've just taken a real interest in critically ill patients.
Good. And so critically ill adults or critically ill infants?
Definitely adults.
Okay.
Children are... They're challenged. Although I do really like a challenge, I think children are a totally separate challenge. I think you have to have it takes a very unique person to take care of a child. And although I love taking care of all aspects of life, obviously, my passion is with adults.
Yeah. Okay. So what are you looking to get out of this job if we were to hire you?
So. That's a good question. I'm looking to get a good education, first of all, because, as you probably know, being in nursing school, you see the basic of the basics. You know what I mean? You learn the skills, you learn the disease processes, but you don't actually get to apply those skills and that knowledge too much because you're in a clinical setting. You're always supervised by, a clinical faculty member or an instructor. So I think that once you start your first job, as this will be, because I just graduated and passed my NCLEX, I think it would be irresponsible of me to not look for a job that would give me the educational experience that I'm looking for. So out of this job, I'm looking to gain my clinical experience and to make a career out of it. So.
Good. Well, I definitely think we can offer that to you.
Yeah.
So that wraps up my questions. Do you have any questions for me?
I do. One of them kind of goes back to what we just talked about, the education. What type of orientation do you guys offer to your new grad, especially new grads?
Yeah, so that's a good question. Since you are interested in intensive care, that's takes our orientation to a completely different level. So we have, when our new grads come into a med-surg unit, we orient them with a preceptor for a few months, and we give them up to a year to get adjusted. But it's taken at their own pace so they don't feel rushed. When we up that level to intensive care, we not only put you through that kind of orientation, but we also put you through a more educational base. So you will not only be with a preceptor, but you'll also be in the classroom with new grads that are also going through the same experiences that you are.
That's great. That's great. That sounds like something I'd be interested in. And this is kind of a simple question. What kind of ratios do you have with nurse to patient, out on the floor and in the intensive care?
Okay. So out on the floor, if we were to do med surg, it's we try and keep it under 6. With intensive care, we try and keep a very standard 2 to 3 ratio, depending on the acuity of the patient. So we really try and individualize that care, and we don't really just look at numbers. We look at how much care that patient is going to need.
Right. That's great. I think a lot of hospitals sometimes steer away from that and just look at how many patients and how many nurses they'll need. So that's cool. That's great.
Yeah.
That's it. That's all I have.
Okay. Well, it was very nice to meet you.
You too.
I look forward to hearing from you.
Thank you for the opportunity.
You're welcome.